Hello, everyone. Welcome. It's currently Tuesday, October 20th, and today we're to talk about chronic pain. Welcome aboard. This is a good time now if you want to hook up any of your contacts.
Yep, spread the love. Share the video with anyone who you think might benefit from a talk on chronic pain.
And that's roughly a third of the population, so it's not hard to find somebody with chronic pain. I mean, I get it with my headache and neuropathic pain. Talk about it in my pain chapter, those components, because chronic pain is really, really common. So today, I think we'll talk a bit about the onset of chronic pain, and then we'll look at ways that you can hopefully modulate it yourself. Most of us have poor quality methods to handle it. That's what starts people down the opiate path, tragically, and the opiate addiction. So it's well worth understanding how it works. And so the way I like to describe it, it probably has some parallels to addiction and parallels to PTSD. So this was first discussed in the context of chronic pain. And so my favorite example for that is someone who has shingles, which is frequently up around, the breast area, because it usually starts in the midline, goes around to the back. And shingles or herpes zoster is little blisters because it's the same virus as chickenpox. And in doing that, it creates a great deal of pain. And 5% of those people have pain for life, even though the shingles may heal up in a week or two. So what's happening is you get the blisters, you get that severe lancinating, almost intolerable pain, and then it becomes residual. It sends the pain message so frequently up to the brain that eventually a phenomena called wind-up occurs. And wind-up means that the message has gone up so many times that it can be triggered even if the pain on the surface has healed. In this case, shingles is healed, but just the brush of clothing or a breeze in the room can fire it off. And that 5% that get that pain for life, 5% of them go on to suicide.
Right.
It is that unbearable. So treating that chronic pain, the old treatment, back in my days of anesthesiology, you would try and block that pain when they had shingles with a freezing block. It was either a stellate ganglion block in the neck or a high epidural block, because it seemed if you could block it completely 3 times in the first 2 weeks, most of them didn't go on to the long-term pain.
Do these people, when you run the antibody test for them, is their body fighting off the virus? Is it gone?
Yes, it is.
Okay.
Yeah. No, the virus is still there. The virus is usually there from when you had it as a kid. Chickenpox as a child, because the chickenpox virus, much like the herpes simplex virus, so one's herpes zoster, that's a chickenpox shingles virus, and herpes simplex, 1 and 2 are the ones that you get in the mouth and in the lips and in the genitalia. 1 and 2, and they can cover each area, although each one is specific a bit. But they tend to live in our nervous system for our lifetime. So they're not going away completely. You may have some antibodies. I heard an interesting comment on it now because they're giving shingles vaccine. Unfortunately, it doesn't really prevent. If they give the shingles vaccine in the first year of life, by the time they're 18 to 20, only 20% of them have immunity anyway.
Okay.
And the tricky part is, often those people are much more possible to have shingles later in life. So anyway, that's a mixed feeling. I mean, I'm old enough, at 67. I had chickenpox as a kid. People used to talk about having chickenpox parties. That's probably not a bad idea in my way of thinking. But anyway, leave those other pieces aside. The phenomena wind-up occurs. Another way to help understand that wind-up occurring is phantom limb pain. So somebody's got a disaster not healing in their foot, or they have a crush injury of their foot, so they have an amputation. And many of those have the pain as though the foot is still there. phantom limb pain. However, if you do a spinal anesthetic or an epidural anesthetic or some other complete block with a local anesthetic of that limb before you take it off, almost zero get the pain.
Right.
So I hope you folks are listening to get a premise. The premise is, if you can have a regional anesthetic, spinal, epidural, or a block, along with a light general anesthetic, whatever surgical procedure you're having, then odds are you'll have much less pain after. Just in the short term, but also in the long-term chronic pain. And so this is a much better option than we might do with just opiates, which of course have their own problems. I'm just going to turn another light on. So what other ways of chronic pain come to mind for you?
Well, I can think of arthritis.
Sure.
And then there's multiple types of arthritis. So there's the rheumatoid arthritis, which is the autoimmune version. I can think of fibromyalgia, which is really just an umbrella term for all sorts of different types of pain and different root causes that would be contributing to those different types of pain. And then I myself had really bad gut pain at one point, and I feel as though it did impact the nerves around the gut, because I can still feel it occasionally, even though I don't really have like the gut symptoms anymore.
Well, and that's a good example too, though, because probably when you had the recurrent, very significant gut pain, the phenomena of wind-up occurred. And eventually the body, hopefully, will kind of retune that, sort it out. And that's why it's worth talking maybe about neuropathic pain, because when we talk about phantom limb pain and pain after herpes zoster or shingles, pain after a surgical procedure, it's a nerve injured type of pain, okay? So that's often the trigger. So the nerve injury, it may be surgical with a knife, and please let go of that idea, because some surgeons still have the idea that if they cut that nerve, they're going to be good. Well, it's been tried for hundreds of years probably now. It doesn't work. It might work for 1 to 3 months, but the body is way too so-called neuroplastic or adaptable, and it'll find a way for that pain fiber to go round.
I have a question. Can vasculitis cause pain?
Oh yeah, quite severe. So vasculitis is spasm of the blood vessel, okay? And there's a number of classic types. There's one that happens in temporal arteritis, the temporal artery coming around here. They treat it with a big dose of steroids. They usually diagnose it by taking a biopsy. But that is major acute inflammation in the vessels. And one of the common groups for that is the systemic lupus erythematosus group.
Right.
Because they can get vasculitis in any organ system. I even saw a young woman who had very significant lupus, and she would even have seizures from vasculitis in the brain. So, yeah, vasculitis is very painful. The other corollary to that pain and its severity is ischemic pain. So lack of blood flow, lack of oxygen. Because it still stuns me how many people go for hyperbaric oxygen, and I point over there because it is over there, I guess, the unit I go into. And many of them, their knee pain or their hip pain or their back pain goes away while they're in for treatment, which shows to me that some neuropathic pain is probably lack of flow into that area, and as a consequence of lack of flow, lack of oxygen, so all of a sudden now you're getting hypoxia. You're getting lack of oxygen, hypoxia. Secondarily, you get inflammation. And part of inflammation, of course, is pain, swelling, redness, and heat. So we can tease those pieces back. And a good example, it's not quite vasculitis, is the pain of diabetic neuropathy. Okay? And diabetic neuropathy is primarily a problem in the tiny blood vessels which supply the nerve. Now all of a sudden the nerve is feeling discomfort when you walk, numbness, burning, all of these neuropathic pain principles, which ideally you would have avoided with perfect control of your diabetes, because then the small vessel disease doesn't progress as rapidly and the kidney disease doesn't progress as rapidly. But if you can't do that, or over a long period of time, you end up with that anyway. So the treatment of neuropathic pain, much the same as these others. So we've talked about oxygen is one way to go. There aren't many medications that work particularly well. There's lots that we talk about, and you can get that all from your regular doctor and or neurologist, whoever's treating that pain for you. But they haven't impressed me. And in all my years of treating chronic pain, I then reached for cannabis, as we talked about a couple weeks ago. That might be one. Another one we might talk about would be photobiomodulation. So there's a whole chapter in that. In the chronic pain chapter, I talk about photobiomodulation quite distinctly, and I'm going to show you something in a minute that is the new way to treat them. So the one place of chronic pain that I haven't mentioned, because I think it's chronic pain to me anyway, is migraine headache, where the pain can last a few hours or up to 3 days.
Yeah.
Okay, so-called cluster headache. And anyway, that's the definition of cluster, meaning it happens 3 days in a row. But it doesn't tend to happen the whole day, but the pain is very severe. And people really struggle with it. It's much more common in women. Maybe I'm getting in touch with my feminine side. British Columbia term. I'm not sure everybody's heard that one. But it's a matter of trying to sort out what can trigger it. So when I learned about photobiomodulation, initially they had what we call a pod. So it looks like a tanning bed, really.
It does.
And you'd be in that, and that would maybe take the edge off the headache, but it wasn't enough to break it, in my experience. Although it would help a lot of that muscle stiffness and soreness. My favorite time to do that is after 18 holes of golf.
Yeah.
Struggle through 18 holes of golf, have a pod of infrared photobiomodulation. It's like having a massage. It's really good. A lot more comfortable. So, and then they came out with a helmet. So we talk about the helmet in my book. It was just kind of newly out. We talk in the Parkinson's chapter, which we're going to get to, of course, in a few weeks. But now we've got the other unit, which I have at home. So I'm going to show it to you today because it's got different settings on it. It looks a lot, to me, like a bicycle helmet. You think? So that's what it is on the inside. I've just turned it on so you can see those flashing lights, those two flashing, are just mostly to tell you it's on. Because this is more of a near infrared rate. I think it's 810.
Yeah, and it's not like an actual tanning bed where you can't look at the lights. You can actually look at these lights.
That's right.
Yeah.
And it won't hurt you one iota. In fact, there is also one that treats macular degeneration. So then I put it on 30 minutes at a particular setting, in this case 20, tends to be a good compromise thing, although people will use it at 40.
Yep.
And that will calm them a lot for anxiety, sadness, depression to some degree. Or you can have it at other settings. Or if I was going to put it on my knee, because this fits pretty well on a knee unless you got a super chunky knee.
I can demo the knee,
Oh, good.
I think.
You're more athletic than I am.
Here we go. Okay,
There you go.
it's on the knee.
Yeah, I trust you. And we won't take your slacks off to prove it. But so we're using it on the knee, and today my wife used it on her shoulder.
Yeah.
So
But, yeah, to that point, ideally you would remove the clothing before you put it on. You'll
Yeah,
get
it'll
better
work better.
exposure.
And, you know, of course, I've got minimal hair on top, and that helps.
Yeah.
It's better exposure, because if you've got a lot of hair, you feel a relative warmth of this, but not a serious amount.
Yeah.
So we'll turn that off.
And you've experienced some pretty severe and chronic pain throughout your journey. I know before I came along, you had kind of been through the works with pain, and so you've tried everything.
Pretty well, and this is my favorite at the moment, because I can back off headaches with a tiny amount of narcotics and cannabis, but I don't function very well. But if I put this on for 30 minutes, and so this is just newly out for about 3,000 US, you can get your own home unit.
Mm-hmm.
Because the other helmet is closer to 48,000. So that's
Yeah.
a big spread. So at 3,000 US, and I'm going to also mention where you can get it because the distributor for Canada is Genoa Laser Center, run by Josh Crawford and
Crystal.
his fiancee Crystal. And if you dial 250-701-5380, then you can talk to them. It might make a difference if you say Dr. Code sent you, but whatever, and inquire about one, because I think it's a tremendous asset. We're about to leave, so we're doing one of these next week,
Mm-hmm.
and then my wife and I are off to Mexico and maybe some others, I hope. But anyway, we're off to Mexico, and I will take my helmet with me, because I've had it 2 weeks now, and despite giving talks 2 days in a row, almost 3 hours each day on the weekend, usually the day after would be headache city for me, and I haven't, so I've used this at least once a day, typically once a day, or if I get a headache, I use it a second time, and it is quite stunning. I find it even more helpful than the one that they used in the clinic, because it has a little more emphasis to it, and it's a slightly different frequency.
Mm-hmm.
So it's fantastic to have something, and of course Denise is using it on her knee because that's kind of a grumpy problem for her, and so we'll take it with us to Mexico, and I'll probably do it daily.
Mm-hmm.
I may have no headaches. Wouldn't that be good?
I hope so.
After 40 years, I'm ready to give up.
Yeah, we'll see how you do down there with the heat and everything.
Yeah, that's right. Yeah, that's a variable too.
So we used to work beside Genoa Laser, and I remember seeing some of their other clients come through for other pain-related conditions using the laser pretty successfully. So I used to see people come in after getting into car accidents, for example, and these were people who would also think that they were permanently injured, and then after a certain period of using the laser, they regained mobility in whatever area they thought they were going to lose it in. And I think other neurological related conditions as well. And actually, speaking of that, Lyme was one of them.
Yeah.
Can you explain why Lyme patients might be having pain?
Well, there's probably two reasons. First of all, Lyme, of course, is the spirochete Borrelia. Okay, so the other spirochete, most of you will have heard of, is syphilis. I mean, yeah, I know it's a nasty word, but in reality, it also is a spirochete. So Borrelia is a spirochete, and it's a bacteria that lives within us. Okay, so you have an option of treating in that first month. It's pretty treatable, but after that, it's pretty hard to treat. So where does Lyme like to live in the body? It likes to live in areas of low oxygen. Okay, that's where it's happiest. So one of the common troubles with Lyme is joint pain. Because, as you may or may not be aware, the tendons and the joints have very minimal blood flow. Okay, so it's very easy for them to become hypoxic. As a consequence, there's lots of organisms there, and they flare up into pain, and they produce an inflammatory response. Okay, that gets a bit complicated, and there's a chapter in my book on that very chronic inflammatory response syndrome, or CIRS, written by my medical school classmate, very well accomplished in treating Lyme, took the Shoemaker training, the Shoemaker protocol. She still works in Hawaii and contacts people mostly online, but very effectively in that way. So the other place, of course, in the body that some of us have Lyme, quite severe problems with it, and that's in the brain. Because some of us have probably regions of blood flow being less than optimal, and we're going to get into that next week because we're going to talk about multiple sclerosis, all right, and a blood flow problem within the brain. So in that group of people, if they can treat the blood flow problem, often their pain will get better. And I suspect now the laser may also help them with that step.
Well, this is what I'm thinking. So one of the first Lyme clients that we had was also doing the helmet in conjunction with her FMT. And that was the first time that I had seen someone with Lyme respond really, really well to the helmet.
Yeah, yeah, I know. So the good thing about the helmet, just like hyperbaric oxygen or home oxygen, it doesn't really have a downside. Okay? You can do it several times a day with relative impunity because we are light beings. I mean, we get those frequencies from the light, from the sunshine, and they're often in stages we can't see. Like you saw the helmet, it's got the flashing red, but most of us you don't see because it's near infrared. Okay, it's a particular frequency. And it acts in an anti-inflammatory way. Okay, it down-regulates, it changes the nitric oxide within the cytochrome pathway, which is part of the mitochondrial function in making energy. And because it improves that, all of a sudden it down-regulates some of the inflammatory markers, which is a great help. But at the same time, it also improves oxygenation and mitochondrial function. And that's why, because you mentioned fibromyalgia earlier, right? It's primarily, in my way of thinking, a mitochondrial dysfunction problem. And maybe you folks are getting attuned to this. We're working toward diet, all right? Because up until recently, that's almost all we could work with to be anti-inflammatory. Of course, you've got your heavy hitter anti-inflammatory drugs, the famous, because of Trump having it for his COVID, dexamethasone, which we've had for almost 50 years. And then the other one's prednisone, methylprednisolone. Methylprednisolone was a big deal in MS for a while. They would give it once a month. And if you got an MS attack, you got 3 days, big time of it. That's pretty well disappeared, I'm very happy to report. I think it's still used some, but it's not a great idea in my opinion. So the anti-inflammatory approach, so then we need to try and see how we can reduce the inflammation through changes in diet. And so we can do that several different ways. Why don't we go to one that many people haven't heard about, and that would be oxalates.
Yes, definitely. But actually, before we do that, Cindy is just saying, what are you using for the headache? We were talking about using a red light helmet. So do you just want to show the helmet one more time?
Yeah.
Make sure Cindy sees.
So this is the red light helmet. It looks a lot like a bicycle helmet. It's got a connection in the back, and I can turn on the infrared. And I find that really breaks the headache early on or even midway through the headache.
And he has extremely persistent headaches. I used to tell Andrew to make sure that he did oxygen before he came into our staff meetings.
Yeah, because Bill in a staff meeting with a headache, it's not fun for anybody.
Yeah.
So I get it. Fair enough. After 40 years experience, I'm very happy to talk about headaches with anyone for the simple reason I have a lot of empathy for headache problems. So
yes,
that's what we're
let's
talking
move on to fibromyalgia, which at the beginning of this video I was saying fibromyalgia is an umbrella term, and there can be a lot of different types of pain that go under that umbrella and a lot of different types of root causes. Some of the ones that I have found to be common within our clients have been oxalate overload and also heavy metals, which would definitely play into the mitochondrial piece because both of those things can interrupt the mitochondria.
Yeah, so remember, the mitochondria aren't working well, and one of the common causes is lack of oxygen, and if they're not working well, then they're not making the energy, they're not cleaning the toxins out in the cells. So if you overload the toxins, as you talked about, with either heavy metals, lead, mercury, cadmium, or you overload the oxalates, which are tiny, sharp crystals. Most of you will have heard of gout and gout crystals. Oxalate crystals are even smaller. And people tend to overload them two methods. One is too much in your diet, and your particular body makeup doesn't handle them well. So can you give us a bit of a summary of what's high in oxalates?
That would be beets, chard, kale, any sort of leafy green, really, if you overdo the leafy green. Actually, celery is higher in oxalates, and then certain herbs.
Yeah, the big two, because I don't like soy in the first place.
Right, soy is very high.
And spinach is pretty high, you know, which doesn't go with the old Popeye story of
Yeah.
a big can of spinach, big muscles, because in some people it really fires things up. So exactly the ones that you mentioned, unfortunately, in many of us, black tea will
Right.
trigger it, but also berries, strawberries, raspberries, blackberries, blueberries. Almost all berries tend to fire up the oxalates. So some of us have to minimize how much we do, or we have to cheat a bit, don't we? We take calcium and magnesium before we eat them,
Yep.
and that binds them in the gut so they're not absorbed and they go out the bottom end. Okay? So that is another way to control them. So say you're out at a friend's place, you don't want to say, well, I can't eat that. So you'll sneak your calcium magnesium before you go in the room, and away you go. And that usually helps solve it a lot. Okay. So,
There is also specific microbes that degrade oxalates. So if you have taken quite a few antibiotics in your life, or maybe you just didn't inherit the right microbes through birth, you might not degrade oxalate properly within the gut. And I would definitely recommend if anyone has gut or brain issues to get tested for the oxalates. And you can get a 24-hour urine from your doctor, but the test that we use, because it's the most sensitive, is the one by Great Plains.
so Great Plains has an organic acid test, and I'll go to page 1 in a minute, but page 2 talks about oxalates. Okay, so you can get quite a high oxalates, and I've seen a number of people come by, you know, they were really high, and some people will just be modestly over, so maybe 110%. Okay, that group you want to look back to page 1, because page 1 tells us, do you have an excess amount of the breakdown products in, this is all in the urine, right? Breakdown products of your candida or other moles, and that will come up in different numbers on that front page. And then the other group is often Clostridia, and not just C. diff or Clostridium difficile, but most of the Clostridia entities. So if candida is high and you're over there at 110, 120%, if you get the candida relatively solved, you're not going to eliminate all of it. You never can, or never would want to probably. But if you can get it down to modest again by getting your microbiome healthier and more balanced, diversity, as you always talk about, then all of a sudden the oxalate problem will be minimized. Okay? And then the same happens with Clostridia. If it's in overgrowth, it aggravates and raises the oxalates too, and it's another pain area that we've learned, and we'll be talking a bit more about it in the future. I love the organic acid test because it will tell me how well the body is converting dopamine into noradrenaline or norepinephrine, depending if you're of the American bent on how you say it. And that is controlled by dopamine beta hydroxylase. And there's several things in the gut that will control that. And that could make a huge difference to your mental problems, having, you know, psychosis, hallucinations, and so on, towards autism symptoms, towards depression and anxiety symptoms, and also to bipolar symptoms. So often by controlling your diet, getting that microbiome diversity better again, you know, through seeing someone like Christina, then all of a sudden, I didn't introduce you today.
That's okay.
Christina Mitz. You're probably getting to know. Anyway, Christina Mitz, I'm Bill Coder, so we got that covered. So it's a great lead-in to understand what's going on in the body. It's modestly expensive, but it's simple. It's done on urine, and Great Plains do a superb job of it. In fact, Dr. Bill Shaw, who started Great Plains Labs a little over 20 years ago, spent 6 years with the CDC in Atlanta developing the early forerunners to the organic acid test. And it does give a wealth of other information too, including how you're actually handling your B12, vitamin C, and so on, even CoQ10. So it gives a lot of information that we just don't get in our regular lab tests.
I think it's a really good starting point for fibromyalgia in general, even if it's not if it doesn't end up being an oxalate issue, it could be something else. So, for example, they even have a couple markers that are indicative of whether or not you would want to look further into heavy metal toxicity.
Sure, and I'm seeing a young woman, I've known her mom for a while, she's a pharmacist, but I'm seeing a young woman next week who's been diagnosed by a pediatric cardiologist to have dysautonomia. Dysautonomia, we can make a great deal of difference, and one of the early tests I would like to do would be the organic acid test. And so some of the clues in there, because this individual's had some knee pain and other issues, so all of a sudden, well, maybe oxalates are a piece of this.
Mm-hmm.
And so that test will help us on a lot of fronts, along, of course, the history and protocols and everything else. So we'll take it from there.
Mm-hmm. Yeah, but definitely, if you've ever had kidney stones or pain, definitely try the organic acids test.
Virtually all kidney stones, 95, 98% of them have an oxalate component, all right? So by bringing down the oxalates in your diet and treating these other issues, you will reduce your oxalate problem in the kidney,
Mm-hmm.
which is a good thing to do. Anybody knows kidney pain, pretty uncomfortable,
Mm-hmm.
right up there
Yeah.
with most things. Okay, so why don't we, any other anti-inflammatory diets pieces? I mean, do you want to talk a little bit about dairy and gluten, I suppose, as one of the big inflammatory triggers?
Definitely. Those would be the top two I would start by eliminating. So, for example, we've worked with some arthritis clients who have been able to put their arthritis, the rheumatoid arthritis, into remission for periods of time just by using a protocol where they eliminate these inflammatory items, and that would include the gluten, the dairy, sometimes it includes eggs, it might include grains in general, and it might include lectins.
Yeah,
Mm-hmm.
lectins and sometimes the nightshades. And I guess that's lectins again, isn't it?
Yeah.
The nightshades being, I really don't like to talk about this because I like all these foods really well.
Yeah.
But it includes tomatoes, peppers, potatoes,
Eggplant. And potentially okra, although that's up for debate.
Okay, yeah.
Mm-hmm.
We don't grow that much okra here.
No.
It's a texture you get used to, I think.
Mm-hmm.
When you first try it, you think it's slimy, and not everybody handles that. So it doesn't work well in our household, I know that. So if you can get into an anti-inflammatory diet, and that's why we talk about those pieces, and if you do initially, because I would think 80% of people are going to be solved with gluten-free and dairy-free, but it isn't going to work for everybody, okay? If that doesn't cut it for you, and I've got a client who's, got nasty arthritis, young man, that means he's younger than I am, and he's frustrated with that, and I think we may need to go to the next level. So we get to decide whether we're going to just keep going down the elimination diet route, or we can do Great Plains again. They now have 190 foods are tested on their IgG or immunoglobulin G, which is the small molecule. This isn't done by regular doctors. They're just not comfortable with the idea. They can't get past the IgE testing. And IgE is occasionally it, and that's the one that would show in the skin tests, but I don't find them particularly useful. My preference is the IgG 190 as done by Great Plains Labs. So that's a brilliant place to go to. I know one of my friends was quite astounded. She was still having problems with inflammation. And she found on that IgG test she was exquisitely sensitive to lettuce.
Interesting.
So once she gave up lettuce, things were a lot better. All right, so we can't always predict which one it is. And of course, we can improve most of those issues over time if we can get the gut healthy. The leaky gut syndrome goes away, but it isn't always enough. And it's worth talking about that just a bit because my old treatment for pain, acute pain especially, was a combination of ibuprofen or naproxen along with Tylenol. So I'm not as keen on those anymore for any number of reasons. One is they harden the kidneys, another is that they aggravate leaky gut. especially ibuprofen, naproxen, and other non-steroidal anti-inflammatory drugs. And the prednisone and steroids, of course, weaken the gut lining, and of course the other ones, antibiotics and a whole host of things. So getting the gut lining healthy, because if it's got holes in it, so-called leaky gut, all of a sudden these food proteins creep through and the body attacks them. That's what it's supposed to do. These are foreign proteins. And all of a sudden they're triggering off inflammation throughout the body. Also, if you have those holes in the gut, and you maybe remember this from before, if not, we'll remind you, tiny pieces of dead gram-negative bacteria get through into the body and circulate around. And these are measured by lipopolysaccharide, right?
Yep.
LPS. I'm not sure we can get that test in Canada, but you can in selective places in the United States. And if the LPS is elevated, everything else is up. You've got inflammation of your vessels and atherosclerosis. And that's why paying attention to this, even if you don't have joint pain, you want to understand these pieces, because it's going to reduce all of the inflammation in your body. And that would be the early forerunner to Alzheimer's, 20 and 30 years earlier, because it affects the blood vessels early, a variation of atherosclerosis. All of these pieces tie in together.
Yeah, the leaky gut would also predispose you to oxalate overload.
Because any bits that you eat, it's all going to get absorbed. And think of the oxalates as little tiny, because they are little tiny black sharp crystals. They're not as long and needle-like perhaps as the gout crystals, but it's a similar idea. And so I know you've got your attention if you happen to have gout, but if you have oxalate enhanced, you could really make a big difference to your recovery. So, you got any questions
We
should
don't have
check?
any questions.
Okay, yeah, so I think I mentioned the other. How are we doing?
437.
Yeah, 437, okay, good. So I suspect there's maybe one or two components we've missed, or if you folks want a little more elucidation in the other. Because chronic pain means it's there for probably more than 3 months. Or the other way to look at it is the ankle injury healed up, but it still hurts. Okay, you're normal, x-ray is normal, but it still hurts. Okay, so don't do what some of my neurology colleagues used to do. If I can't find a reason for your pain, it's only in your head. Well, they're partly right, because the wind up has occurred and it's still, yes, being perceived in your head, but you aren't making it up. It's a very real entity. And that's why you need to try and break the cycle of the whole scenario. And that's a little bit tricky to do, but if you can get the whole scenario healthier, you're going to have a much better chance of controlling the chronic pain. I know in early days, one of the early things I used to use on shingles acutely, emu oil worked incredibly well. Okay? And it's fabulous on burns too, because it seems to cover over those, I call them bare naked nerve endings, okay? And when they're exposed to air, it really stinking hurts, all right? So emu oil seems to solve that almost as effectively as those freezing blocks that you did for the area, but a lot easier to achieve. So that would typically be emu oil applied over the blisters and over that whole area for a week to 2 weeks, and then hopefully helping break that cycle. It isn't effective when you've got a skin intact as much as in diabetic neuropathy. So there you're going to have to look at photobiomodulation, perhaps oxygen therapy, of course, better control of your diabetes. All of those pieces seem to really make a difference.
If you treat the shingles faster, are they less likely to become one of those 5%?
Maybe yes and maybe no, because for 20 years we've had an antiviral, and the teaching has been get on the antiviral. But I don't think it's really borne out that they will actually have less pain, unfortunately. I wish it was that simple, but it doesn't seem to be. I don't know which are the group that get the long-term pain, but we haven't done near as well by giving the antiviral as early as possible as we had hoped. It seems to dry up the blisters and so on quicker. I'm pointing to the eye because that's a nasty one when you get it on one side of the face through the eye. Very painful. Usually it's diagnosed by an ophthalmologist and they talk about what they want to use to treat it. It's usually a topical steroid, antibiotic, and an antiviral to try and get it controlled because it's really very painful and can even scar the cornea if you're unlucky.
Right.
Yeah. So I think if we look at that group and then cannabis we've dealt with thoroughly before. Other chronic pain issues. Well, if we can control the chronic illness, which is triggering the chronic pain, that will often do well. And you've talked about the arthritises, okay, which is focused in the joints. I think of fibromyalgia as particularly being, the fascia, the connection all through the body, because that's why it can fire up everywhere with stiffness everywhere and all these sorts of problems. But each of them have their own sort of scenario. And there's no question, if you're not as healthy in your brain, meaning you're tending towards sadness or depression, it's a double-edged sword, because people with chronic pain have much more problem with depression. People with chronic pain have much more problem with, mood swings, sadness, and severity of their chronic pain. And that's why one of the things that has been reached for is the antidepressants, and we're going to get into that in the mental health chapter. As you may or may not have noticed in the book, we're now into the section 5. There's 6 sections in the book, and section 5 is specific diagnoses, all right? And so within this section, we'll be talking about MS, headaches, to some degree again, but certainly Alzheimer's, traumatic brain injury or concussion, post-concussion syndrome, PTSD, because they fit together, Parkinson's, and so on. So and there is another chapter on mental health. So that's the region we're into. We got through pharmacology. Pharmacology was a whole collection of things, ending with addiction last week, and then the 2 weeks prior with cannabis.
Right.
So it was an interesting weekend. I was giving a talk to Spanish folks. It was originally going to be in Mexico City, which I was all in for, but of course that didn't happen with the COVID problems. And so we did it in a Zoom, and I was talking to parents of autistic spectrum children, and then I was talking to physicians of autistic spectrum children, and I was really happy because I was able to promote my Spanish edition of my book. That's roughly the same cover, the same little quote from Dr. Andrew Weil, but and was delighted to sell books into Portugal, Chile, Mexico, and across the United States. So now many of them are buying the ebook online. That ebook is online. Within a week or 2, we will have the French ebook online and probably the German ebook online. So that's coming. And then going to print, we've already printed some Spanish copies, and we'll be soon printing, so it'll be a month or 2 before they're ready, I suspect, the French edition. And then we have the German translation done, and if people know of someone that's very good at translating into Chinese, have them get in touch with me and we can maybe see about that, because I know that's a group of people who might be interested in a Canadian recommendation. Yeah.
I can also think of a couple herbs that are usually recommended for pain and bringing down inflammation, and that would include something like curcumin or boswellia.
Yeah. Boswellia's other name is frankincense, isn't it?
Right, yes.
And so that's terribly underrepresented. Years ago when I had a topical pain cream based on emu oil and other things, we would use, so salicylic acid is wintergreen, okay, so that's the natural herb for it. We didn't have one with curcumin in it because it's always hard to dissolve. That's the challenge with curcumin. But we did have boswellia in it. And I know some people have had huge benefit and response with frankincense or boswellia. Same thing.
Yeah, it's one of my favorites.
Do you have a favorite company with their curcumin as far as a quality one?
No, not off the top of my head.
Yeah.
No.
I recommend the AOR one, but there's a couple of other good brands out there. If it isn't working for you, check the brand or the type, and you may not be absorbing it because it's a little tricky to absorb, but it is incredibly useful.
Actually,
yeah.
clients have told me that they really like the one that's, so if you look at the bottle and it says, it'll say on the bottle that it's either turmeric or curcumin, but then the companies have purchased that from somewhere and it'll be a specific type of turmeric or curcumin. So the one that is Mariva Phytosome, that one works really well.
Mariva, M-A-R?
M-E-R-I-V-A, Phytosome.
Okay, phytosome.
So it's liposomal.
Phyto means plant, and it's in a liposomal format?
Yeah.
And they take it orally?
Yeah.
Okay, yeah. Because if you get it into a liposomal version or something that helps it be absorbed, that's a big factor. I mean, I've got a friend, he's a physician, and he uses almost a mound of curcumin every morning. And he's quite very keen on it because his parents have struggled with memory and Alzheimer's and so on. And you need to take a lot in, especially if you're only absorbing a little. So that's the key piece. And so if you can find one that's better absorbed. So I tend to look around for ones. More recently out of Calgary, AOR has a pretty good quality curcumin in my opinion. And so, you know, that's a place to go.
We do have one question. If depression is caused by MTBI or chronic pain, I found that antidepressants can be ineffective. If it's caused by damaged neural pathways, won't antidepressants be largely ineffective? Do you have suggestions?
Well, it's a good question, Roger. And yeah, you have hit the nail on the head pretty well. If you happen to read my mental health and antidepressant chapter, I don't think they work very well. And you know, most of the data, when carefully looked at, shows that they don't make much difference. And it also, if you peel back the onion further, it was very weak information that in the 1950s and 60s they showed that depression theoretically would be a lowering of serotonin. But that actually has never really been proven one iota. Okay? So having a serotonin reuptake inhibitor, taking it, yeah, you'll feel different, I get that. But as far as reducing your depression, probably not. And so it's better to find, you know, ways to reduce it. So particularly, let's talk about traumatic brain injury. Okay, I think the M means multiple, I imagine. Concussion, once, not great. Twice, even less great. 3 times, 4 times. Now you're really stacking up because unfortunately they tend to be additive over time. And we're going to spend a whole session on traumatic brain injury. But you're right, one of the chronic problems is either headache or other chronic types of pain. And so it's better to go to the solution to solving it and getting the brain healthier. So anytime you bring down the inflammation, you'll bring down the pain some. Okay? And the inflammation, of course, is what depression is. All right? And that's why my favorite for treating depression is things like omega-3 fatty acids. And my, you know, the mainstay simple ones are fish oils with high EPA and DHA. And when we're talking chronic pain as far as arthritis and this sort of group, or any inflammatory problem, including atherosclerosis for that matter, 3,000 milligrams of EPA plus DHA in combination, okay? And that ideally would be a fish oil that's cleaned up because our oceans are pretty polluted, unfortunately. And then that's kind of one of the mainstays for it. We haven't mentioned today vitamin D, but of course it's a very powerful anti-inflammatory. 2,000 units, I mentioned it in the chapter, so I should remember to bring it up here. 2,000 international units of vitamin D is already anti-inflammatory. If you go up to 4, which is my recommended minimum for people over 35, 40, which is 0.1 milligrams, so it doesn't sound near so nasty, but 4,000 milligrams a day. And if you have a malabsorption problem, or are obese, or for whatever reason you're not absorbing much of the vitamin D, you may need more. You may need 7,000. When I was on a gluten diet, I needed 12,000 units to maintain a good vitamin D. When I'm off it, I can get by in about 7,000 units a day.
Right. And the new kid on the block for omega-3 is actually calamari oil, which will have less mercury in it. Calamari squid is known to be really high in omega-3, and I think that's a really good option. There aren't too many companies doing it yet. It's pretty new.
So are they pretty good for mercury? Because they tend to live near the bottom, don't they?
Nope.
Oh, they don't?
Mm-mm.
Okay.
Yep.
I haven't followed a squid around as much as you have, obviously. Good for you. Well, that's exciting to know because there's squid's relatively available.
It really is.
And could be a good source. And of course, the phytoplankton, which make the omega-3 in the first place, and then they're eaten by the fish, and that's why if I'm going to get fish oil, I prefer to have sockeye salmon fish oil. Of course, you can't buy it, you just buy a group of sockeye salmon, or of salmon rather. The larger the salmon, of course, the more they are up the food chain, and the small salmon or the small fish eat the phytoplankton, and then they're eaten by the bigger fish, eaten by the bigger fish. By the time it goes up the food chain it weighs, by the time you eat it, if the salmon or the tuna is more than 10 pounds or 4.5 kilos, it's even higher. So look at that base, or when you buy one, make sure it's had CO2 extraction used, and most of them do now if they're a quality fish oil. This is not a good place to cheap out. Buying straight salmon oil, I mean, they learned a few years ago, if they, instead of canning salmon with the oil in it, they squeeze all the oil out, put it into capsules, and sell it, and then water pack the salmon. But that hasn't been cleaned up, and there's a fair amount of heavy metals in it, and other dioxins and other things you really don't want. Because right back to the beginning, secret of detoxification, quit putting nonsense or toxic foods into the body. All of a sudden, you're slowly going to clean up.
And then it's essential that we mention oxygen for TBI. Some of the best results I've seen have been when the TBI patients use the oxygen.
Yeah. And so, yeah, thanks, Roger. You put what the M stood for you, mild traumatic brain injury. It's a really tricky deal to decide what's mild and what's moderate and what's severe. I mean, severe is not hard to figure out, but where are people on the continuum? Because it can be a real rough go for some people, even though theoretically it's mild, okay? And it can be not bad for some people, even though it's moderate, or they're used to living with it, or whatever the faction happens to be. Yeah. Okay, good. So what we want to, I think, reiterate, let's go over again. So we tried to talk about what chronic pain is, how it happens with wind-up. So recurring focus from a pain, say an injured shoulder, okay, it happens enough times that even though the shoulder is maybe healed, or maybe you're going to go under the knife and have surgery for it, but you may still have the pain because you've got to solve the wind-up phenomena that's happened to kind of imprint it or form a reflex arc pathway, which is what wind-up means, to solve it, all right? So preventing the pain in the first place by freezing or blocking the pain, whether it's a shingles infection or whether it's you're going to have your foot off or some other operation, or maybe you're having a big abdominal surgery, go with regional anesthesia component because that will bring down the pain. That's going to peak afterward, which is a wonderful thing to do. And of course, joint replacements, they prefer to do them under local anesthetic, block of spinal or epidural or one or the other, along maybe with a light GA if you don't want to be awake, fair enough, hearing the saw or whatever the thing that might bug you, and it might bug you a lot. But by blocking that ahead of time, the surgeons like it because it lowers the blood loss in the field because it makes that part of the body hypotensive. So they can do the operation with better vision, and you benefit less blood loss. Yeah, so that kind of fits the pieces in together.
I met a man who was in a coma and was brought out of it when his parents put him in the hyperbaric chamber.
Really? Yeah. Well, no, it's very interesting to see how frequently the oxygen will help, and I think that's because a part of that pain is hypoxia or ischemia, and the neuropathic pain, the one I have with MS, used to be it felt my leg was broken. It really, really hurt in the lower leg, and I finally had a broken leg on the other side, and it was nothing compared to the pain in the left leg. So that was the nerves injured within the brain with the perception that the problem is there, that the leg is broken or feels burning and hot and knife-like. But that's a perception. Think of it as short-circuiting of the nerves. They're getting mixed messages, and they're not getting the right perception to you. Okay, so I think in summary, next week we're going to talk about MS, so it's chapter 20. I'm just going to read the title of the chapter so I get it right. It's going to be a lot easier if I do it in English.
Let's see if I can figure it out.
You can do it in Spanish. Good for you. My Spanish is not that good. I can find, say please and thank you.
Chapter 20 is migraines and epilepsy.
Okay, so we've got a different chapter. The one right after chronic pain. I was thinking it was 19, but I could be wrong. Here we go. So it's the new MS is what my chapter is called, and it stands for microvascular syndrome. And you're right, it's chapter 19.
Yeah.
So I was a chapter out. This week we've been on chronic pain, which is 18. Next week we're on 19. So in this we'll talk about MS and all of its forerunners to it, but we'll take very much an approach on the vascular issues within MS, because it's my impression that it is primarily a vascular disease in regions of the brain or hypoxia. So we'll get into the details of that next week. And so bring your questions on CCSVI, bring your questions on oxygen, how to treat it. Even if you can't get access to hyperbaric, I'll be talking about things you might do instead, which might help you control your symptoms, and we'll follow up from that. The week after that is one on headaches. And there is a bit of crossover, as you may or may not know. MS people, up to 70% of them have problems with headaches. Okay, so I'm very sympathetic with that group, of course, and we'll follow it up from there. So we hope you will let your friends know about this, taping that we've given you today. And if they don't have access to Facebook, send them to drbillcode.com, DRBILLCODE, because you're getting it put on there. And then our friend Piper is helping us out, putting it into an audio podcast. If your life doesn't work for videos, then please don't do videos while you're driving.
Yeah.
But audio podcasts, that's quite reasonable and good. So you can download it from there. Just look under the blog section under Dr. Bill Code. And that's, of course, where the easiest place to find my book, to find these podcasts, and now to find the Spanish edition, soon the French and German edition, or hardcover books.
Excellent. Okay, well, we are basically at 5 o'clock, so I guess we will end things and see you guys
folks,
next Tuesday.
Yeah, have a great week. We're out finishing harvesting. It's time to finish the harvest because it's supposed to be freeze tomorrow night, and maybe later in the week they're talking snowflakes.
Oh.
How exciting is that? I know Regina apparently has a foot of snow. I don't envy them that, but we're going to get some, and as of Monday, well, next week, but 2 weeks from now, we'll be in the hot sun. So take care and have a great week.